कोई रात्यों नाली हट पल्लो शिकाटी को लटके रे अगल बगल की कैमरियां.
Padma works in Rajasthan, a state in western India. She's one of many women who travel to rural communities promoting health and family welfare for the government. She's called the ANM, or Auxiliary Nurse Midwife. Today, Padma is visiting her own village, Narwar. She is trusted and respected by the villagers, who look after her twin daughters while she is working. Seema is one of Padma's patients, and she has travelled to Narwar to be with her sister during her pregnancy. Often, villagers are suspicious of taking treatment when they're pregnant, but Seema knows and trusts Padma and has come to her for antenatal care. Padma has 5,000 people in her care. Most of them live in the desert. They make a living by farming, making pottery, enamelware, and colourful fabrics. The two villages and hamlets she looks after are connected by narrow roads and sand paths. She reaches them by foot or by moped. Her region covers an area of 40 to 50 square kilometres, and somehow she manages to visit all her people at least once a month. She treats everything from camel bites and personal injuries to seasonal diseases like malaria and typhoid. She carries immunisation vaccines to the villages and holds antenatal classes with local women. Her services are free of charge and available to everyone. The scale of the healthcare system is really impressive. Administering healthcare to over 900 million people is no easy task. As the population keeps rising, so the government has taken steps to contain its growth, and it is through people like Padma that the government can reach villagers and educate them in family welfare. Every month she has to make contact with a specified number of couples of childbearing age and try and establish a method of contraception for them. In remote areas, the villagers are often not keen to listen to her. Their survival is based on having children, especially boys, to bring in income. This family is reluctant to give Padma their names for inclusion on her eligible couples list. Her job is very difficult and varied. Padma says it isn't easy to make people understand what is good for them. However, she derives much satisfaction from her job and enjoys the independence it brings her. At the end of the day, Padma and her colleague have visited 9 houses in Narwar and seen 45 people. She makes notes in her diary as she goes from house to house and records her visit by marking the date next to the front door. She returns to her office at the sub-centre and transfers the notes from her diary into a register. She records the numbers of treatments, medical supplies distributed, and the eligible couples she has met. Every month she compiles a report and gives it to her sector supervisor, Mr. Joshi. Mr. Joshi is responsible for 8 of the 223 sub-centres in the district of Ajmer. Each month he compiles a report of the ANM's activities and sends it to the local primary healthcare centre, some 40 kilometres away. It is here at the primary healthcare centre that malaria slides are examined, patients referred, operations performed and records kept. There are 8 primary healthcare centres in the district, and at each one there is a man called the computer, whose job it is to keep records and coordinate various directives from the district to the sub-centres. His job brings him into contact with villagers, ANMs, doctors and government officials. Today he is attending a training session for women who want to join Anganwadi. These women are the eyes and ears for the ANMs in the villages. They will alert her to potential problems, pregnancies and seasonal diseases. At these training days or camps, doctors and officials from the district travel by bus to the rural primary healthcare centres and perform operations and training. Today, the Deputy Chief Medical Officer for the district, Dr. Ashok Singh, is addressing the women's group. He is instructing them to tell the village women to take more care of themselves, that having many children will make them grow old quickly and impair their health. He asks them questions. Where do mosquitoes breed? How do you treat a fever? How much water do you use to mix an oral rehydration solution? Dr. Singh has worked in the district of Ajmer for 18 years. He too makes reports to his supervisors based on the district's monthly activities. Ajmer city is a busy trading centre made famous by its Muslim shrine called Dargah. It is surrounded by ancient mountains with a lake at its centre, and each year thousands of people flock to this bustling city to make their offerings at the Dargah. Our experience working in one district in the state of Rajasthan has been very positive. At every level, we have met dedicated people who are providing a service in often adverse environmental conditions. We are investigating how technology might help rural healthcare workers do their job.
हट पल्लो शिकाटी को लटके रे अगल बगल की कैमरिया बट गया निराजन बावण्या कोई रात्यों नाली हट पल्लो शिकाटी को लटके रे अगल बगल की कैमरिया